This is PressPlay. I'm Madeleine Brand. The T in LGBT is having a moment. There's the new Amazon show, Transparent. There's the transgender character played by a trans actress in Orange is the New Black. California now allows transgender public school students to use the bathroom they want and to join the sports team of their choice. The profile of transgender Americans is rising. And as it does, more people are identifying themselves as transgender at younger and younger ages.
But be careful about the dirt pile over here because it's really slippery. Look what I do when I do it on it.
Anna is 9 years old. She likes to ride her bike and play with her little brother Joey, and she's kind of a motor mouth. What do you want to be when you grow up?
It's a lot. Bullet train driver, flight attendant, supermodel, singer, actor, lawyer, detective, police officer.
She's super athletic. She likes Beyonce. And Anna was born a boy.
At about 3 years old, we started, once he was verbal, started getting feedback that he was not a boy, that he was a girl.
That's Josh, Anna's dad. So what do you do when your 3.5-year-old boy tells you he's a girl? Not just once, but over and over again.
Like so many parents, you just sort of redirect to what you think is the right thing for your child. So you can wear whatever you want, honey. But when we go to school, you kind of wear a uniform. Like daddy goes to work in a suit and a tie. Your uniform is boy clothes.
That worked for a while until it didn't.
We'd had the whole weekend in Disney princess outfits. And Monday morning, I was pulling this dress off of his shoulders, and he was resisting. And I want to wear it to school today. And I said, honey, we got to get this off. And as I pulled, and these aren't real clothes, they're just costumes, so they're not really strong fabric. One of the seams ripped, at which point my son just collapsed into my lap, sobbing, like I had, broken his spirit. And that's kind of what it felt like for me too. So I was crying and he was crying, and I realized I can't do this anymore. I can't, force this kid into it was a straitjacket of expectation. It was not fair.
Why was it? Why were you so insistent that she wear her boy uniform to school on Monday morning?
I think for me, it was, honestly, I think it's because I'm a gay dad, and my husband and I, there's expectation, I think probably people expect that we wouldn't have proper gender role modeling in our home. So I think I was hung up on my own issues around this, that people would assume, okay, so there's no mother in this family, then that's probably what triggered this.
And so Josh and his husband went to an expert.
We actually are the only center for Transyouth in this area here in Los Angeles, certainly in Southern California, and we are hands down the largest center for youth in probably the world.
Dr. Johanna Olson is the medical director of the Center for Transyouth Health and Development at Children's Hospital here in LA. Right now, they see 355 young people, with 60 more on the waiting list.
It's very rare that a child will assert a transgender identity. It's very common for girls to be tomboys. It's quite common for boys to just want to do girl things. But the difference is those children, as they progress along in their development, are not saying, I am a girl or I am a boy. That actually is very, very uncommon. So that assertion of your gender with that kind of consistency, persistence, and insistence over time is a fairly good indicator that somebody's going to continue on with a trans identity.
In Anna's case, though, she did more than just tell her parents she was a girl.
Our daughter was trying to cut off her penis at one point. This was at about 4. We were frightened into making an appointment very quickly at the hospital. We met with Dr. Olson here, and she said, don't worry, I deal with this all the time. Bring her in. We sat in her office, and she said to her, so I understand you tried to cut off your penis. She said, yeah, I don't really need it. She said, okay, let me explain. And she said, you know what my job is? I'm a doctor, and I'm an expert at this. This is something I know a lot about. You can't hurt your body because I'm going to help you get what you need.
Dr. Olson and her team recommended that Anna go through a social transition, that she present herself to the world as a girl.
Barbie dolls from the 70s, Barbie dolls from now.
And that's exactly what Anna has done. Ever since she was 4 years old, she's 9 now, she's been called Anna by her friends at school, is known as she, wears girl clothes. She lives her life as a girl.
Rihanna wigs.
But not everyone who works with transgender children agrees that switching kids so early is a good idea.
Very young children have very concrete notions about gender, and they can be quite rigid in their thinking about gender.
Dr. Kenneth Zucker is one of the leaders in his field. He's been working with trans children for nearly 40 years at his clinic in Toronto, and he headed the group that defined what it means to be trans for the latest DSM. That's the Diagnostic Bible for Mental Health.
I've heard young kids say, well, I don't like to sweat, and boys sweat and girls don't. Therefore, I want to be a girl. Or boys are stronger than girls, and I want to be strong, so I want to be a boy.
Dr. Zucker prefers therapy, working with young children to help them be more comfortable with their bodies and to help them realize that there are different ways to be a boy or a girl.
Even children who are presenting in a very strong, intense way may be able to sort this out so that as they get older, they feel more comfortable in a gender identity that matches their birth sex.
Anna seems well-adjusted and happy as a girl, but she has a big secret that is sometimes difficult to keep private.
Our child really doesn't want people to know this about her. At 4 years old, 3 years old, she, didn't really care. She wanted everybody to know. But once she hit kindergarten, she was really clear. She didn't want anybody to know that she used to be a boy. And that has continued and intensified. She's very concerned that somebody's going to say something about it.
Anna is what's known in the trans community as Stealth. In fact, Anna is not her real name, and her dad's name isn't Josh. He asked that we use those names to protect their privacy because they've learned some hard lessons about people's reactions to Anna.
In kindergarten, it was the first year that she was living sort of stealth. And she told her best friend, and then her best friend told her mom, who then told a couple of other moms, and then we all ended up in the principal's office because they wanted our kid out of the kindergarten class. That's a little.
But why did they want her out?
One of the moms said, she needed to know to protect her child. So I'm not sure exactly what that means because they were best friends, but that friendship ended.
I asked Josh, now that he's gone through all this, Anna's still so young, does he ever worry that this might just be a phase, that she might someday change her mind and want to go back to being a boy?
It may happen for some. If it does, that's fine. I mean, we're totally prepared for that. The only thing that we've changed is her name, her hairstyle, her clothing, and pronouns. There's nothing irreversible, but every indication we've had from our child since she was verbal, which is now almost 6 years, is that this is a little girl.
If that's true, it's rare, according to Dr. Zucker, the expert in Toronto. He says only about 12% of the kids he's seen remain trans through adolescence.
Yeah, I didn't really know what it was.
Quinn is a 15-year-old trans girl.
I just felt very uncomfortable with what, people said my gender was, but not everyone.
Her mother, Mary, like many parents of trans kids, assumed Quinn was gay until she was 10 years old.
Someone astute enough to see that this was a transgender child asked me if I had ever thought about it. And I thought to myself, no, I had never thought about it. And I asked her. And she said, well, of course, I'm a girl.
Yeah, duh.
That was Quinn in the background there. She says it was hard sometimes, feeling like she was in the wrong body.
When I was younger, I was going to go to the pool, like a public pool with my cousins. And I had a girl's swimsuit. And my aunt was kind of like, well, no, you can't do that. What if you have to go to the bathroom? And my cousin and I were just like, I'll just go with Sandra. No big deal. It's fine. And she's like, well, no, that'd be lying to people. And it was, ugh.
Before puberty hit, Quinn started taking drugs called blockers. They've been used for years to treat children who start puberty really early. Now they're also being used for transgender kids to keep them from developing in a way they don't want to. Picture someone who believes he's a boy getting his period, or a girl developing facial hair and a lower voice.
When my dad started explaining to me about how puberty worked and what it was, I was quite terrified. I probably would have killed myself if I had to go through male puberty, if I'm being honest.
Blockers are temporary. If you go off them, regular puberty will just start up again where it left off. But for those who stick with it, the next step is a big one: hormones, artificial testosterone or estrogen.
I was probably on blockers for a year before I started hormones, just before we could get me on hormones, obviously to keep me from starting puberty. And then for almost a year now, I've been taking estrogen.
And is that, in what kind of form is that?
It's a pill.
The blocker is, it's an implant, and then the estrogen is a pill.
Yeah. I have an implant in my arm right here, which I guess the people listening can't see, but it's in my arm, people listening. That just does its thing, and I take my hormones, and that does its thing. It's basically just going through puberty.
One of the arguments for starting hormone treatment early is that trans women will look more feminine and trans men will look more masculine. And just looking at her, you can't tell Quinn was born a boy. She has long hair and she wears lip gloss and has a teenage girl's body. But with the artificial hormones, there are irreversible consequences. The body changes, of course, but also infertility. Quinn will never be able to have biological children, and that's the same for girls who become boys.
Most kids, teenagers, are like, I don't want kids. Are you kidding me? So we do talk to them about that and say, listen, you need to know that this is what's happening with these decisions around your gender incongruence, that this is something that you're giving up, that you're taking away. Is it a bad choice to have to choose, I cannot have biological children, or I can live in a gender role that isn't right for me? Yeah, that's a terrible choice to have to make.
For now, Quinn just has normal teenage concerns. Are you interested in dating?
Yeah.
Boys, girls?
Yeah, and others. I know, in society, we do look at gender as a binary system, but that's not really the case. There are a lot of people who don't feel like male or female is their gender.
What about you?
I identify as female fully, personally. But, I have friends who identify as agender. There are people who are gender fluid. There are people who are demi boys, demi girls. There's just, so many people in the spectrum that, people don't normally know about.
What do you think when you hear all this, Mary? You're shaking your head.
She's kind of amazing.
So, in the end, what is gender? At Children's Hospital here in LA and at the clinic in Toronto, both Dr. Olson and Dr. Zucker say they're now seeing more patients who refuse to identify as any specific gender.
We're now starting to see more and more adolescents who are not identifying as trans, but are identifying as gender neutral or gender fluid or even as agender, having no gender. So there's more and more recognition that, in a sense, there are more than two genders.
The most increased number of young people that I see in my practice now are folks who say truly, I don't resonate with this idea of feeling male or feeling female.
But the question remains, are we born this way, or is it something we learn? And here's where the two doctors differ. Dr. Zucker says the environment plays a big role, and Dr. Olson believes it's something more innate.
We don't know. We don't know. But what we do know is that gender is a very essential component of our core selves. People who have lived their whole lives in one gender role give that up in order to live authentically. That says something about the power or the importance of gender to our core selves.
For Anna, who's only 9, none of this stuff, blockers, hormones, even sex reassignment surgery, none of that is even part of the conversation yet. She's just living life as a young girl who has recently entered 4th grade.
One day, about a year ago, we were driving in the car. She's 8, so it had been about 4 years since we transitioned. And she said, Dad, I don't think I'm transgender anymore. And I didn't say anything. I just sort of paused. About a minute later, I said, what do you mean by that you're not transgender? I mean, that's fine, but what do you mean? Should we start calling you by a different name? She said, no, I'm just not transgender. I'm just a girl. And that explained it all, because actually that's all it ever was for her. It wasn't that she wanted to be a girl. It was always, I am a girl. And there's a difference.